Hmm. All right. Good morning, everybody. Welcome. This is our last CRIS Steering Committee meeting of 2024. So excited to see everybody. I am Jamie Strauss-Clark, your facilitator. I'm going to give folks a moment. Looks like people are still popping into the meeting from cyberspace. All right. Welcome, everybody. Again, this is the House Bill 1477 Crisis Response Improvement Strategy Steering Committee meeting and the last one of 2024. Before we dive into our agenda, I would like to briefly remind everyone of, and I'm going to go really briefly, remind everyone of our Zoom etiquette for this meeting. So Christine, if you wouldn't mind advancing the slide, please. I have two slides, one for steering committee members and one for community members and guests. So for steering committee members, please keep your mics on mute and your video cameras on. And Christine's going to just remind everybody where those buttons are, although I'm sure you all know it really well by now. And then if you would like to go ahead and advance there, Christine, if you'd like to make a comment or ask a question, please raise your hand using the reactions button that pops up a window. Click up the raise your hand function and I'll call on you in the order in which I see you. And I think you can just advance ahead there. And of course, steering committee members, if you want to communicate with me via chat rather than speaking out loud, you can certainly send a chat to me, Jamie Strauss-Clark. Next slide, please. Okay, this one's for community members. Community members, I'm going to ask that you keep your microphones on mute and your video cameras off for this meeting. It's just so that I can facilitate directly with our steering committee members. The exception is when we get to the public comment period at the end of the meeting. As of now, I don't have anyone signed up for public comment, but if you would like to make a public comment, we will have time at the end of the meeting. Please send a chat to Christine Milana. You'll see her name in the chat function and let her know that you would like to make a comment. And then when we get to that part of the meeting, I'll remind everybody about our protocols for making public comment. All right, skip ahead, please. Okay, so here's what we want to accomplish this morning. And we have a relatively short amount of time to do this because we do have a steering committee member that has a conflict starting at 10:30. And we really need to get our conversation wrapped up by then regarding the report. So our focus this morning is to approve the 2025 final report to the governor and legislature and confirm action items and next steps and hear public comment. Advance the slide, please. All right, so here's the plan. Moving right into welcome introductions, review meeting agenda. We're gonna actually make that really short so we can get right into our discussion and make sure we get that wrapped up so that we can have a vote from our steering committee members on the final 2025 report. It looks like, so we do not have a personal story today, unfortunately. It's a tough time of year to get folks in for this, so that's not going to be happening, but we'll do our discussion of the 2025 final report and then move into action items and next steps, and then our public comment period. Again, members of the public, if you would like to make a comment, please send a chat to Christine Milana and she will make a list and we'll call your name in the order in which we receive your request at the end of the meeting. Advance the slide, please. All right, so without further ado, let's move right into our discussion of the 2025 final report. And I'm going to turn it over to Nicola, who's just going to give us all a brief reminder of the process for getting to this moment where we have this final report, and also remind everyone about where they can find and review the feedback that we received and how it was addressed in the report. So Nicola, you're up.
Thank you, Jamie. Good morning, everyone. Great to see you. Christine, if you could take us to the next slide. Just wanted to start off by a brief refresher on the process to finalize the report this year. So in September, the CRIS committee met and reviewed an initial summary of committee recommendations at their in-person meeting. And that summary included a synthesis of recommendations that the committee has worked on over the past 3 years. So in addition, Bipasha and Kristen Wells presented on the Lived Experience Stories project, and the committee reflected on some of the key insights coming from the Lived Experience Stories Project and the voices of people with lived experience of the system. In October, we then moved to focusing on drafting the final report, and we delivered a draft report for review in November. So in November, you can see that there were opportunities for tribal review at the November 4th tribal listening session and the November 20th tribal subcommittee meeting. And the CRIS Committee reviewed and provided feedback on the report at its November 13th meeting. We then integrated feedback and updated that draft report into a final draft. And that is what you have before you today for review and requesting your approval within the draft today. And I'll highlight some of the key changes made. We integrated the comments and updated the report to address that feedback. In addition, we added a letter from the steering committee and a further expanded the what's next section for your review. So we're here today, December 16th, for discussion of the report and aiming to submit the report to the legislature and governor by January 1, 2025. So Christine, if you could take me to the next slide. This is just highlighting the key changes that I just noted. So I think we've got and provided in advance of the meeting a summary of the comments received and how we address those comments within the updated report. And I'm happy to go through those in a moment. In addition, we added the steering committee letter, which is at the top of the report, the very first page. And then finally, at the end of the report, we expanded on the what's next based on the CRIS discussion and input in November. So those are the key changes that were made. I think, Christine, if you could pull up the summary of comments. And I will just highlight some of the comments at a high level, as I know we are having a short meeting today and want to give a chance for you all to ask any questions. So. Okay, thank you. All right, so this is just an overview of the document we shared in advance of the meeting. Christine, if you're able to make it just a little bit bigger. There were some very helpful comments where we addressed a number of areas of feedback. Just to highlight, one of the top comment we highlighted here is the concern CRIS members expressed around the state budget and a request recognizing the number of recommendations, the request for prioritizing and or highlighting recommendations that would inform legislative versus ongoing agency work. So we did add a symbol coding within the report to distinguish recommendations that would require legislative versus can inform ongoing agency implementation work. And happy to highlight that for you in the report, but just wanted to note that. The second comment around funding, there was request to clarify that funding recommendation as it applied really through, it's an underlying or overarching recommendation. So we did pull that recommendation out and framed that more clearly in the report as an overarching recommendation that recognizes funding needed across the other committee recommendations. And then finally, Christine, if you could just scroll down a little bit. Also wanted just to highlight the point, comment number 5, where there was, concern that the report conveyed that, in the way that we summarized the progress on many of the recommendations, that the report, might sort of be misinterpreted to convey that the work is done. And so we added several places in the report where we really highlighted that You know, the goal really is to recognize and celebrate the progress that's been made, but also to emphasize that this is continued work needed and long-term effort to continue to reach the committee's vision of crisis response in Washington. So just wanted to note that for you all. Otherwise, I won't spend, you know, I think we provided this in advance, happy to address any questions you all have, but just wanted to highlight some of the key changes made before I turn it back over to Jamie and you all for any questions. And Christine, I think you can go ahead and take it down for now. Thank you.
Thanks, Nicola. And for everyone's note, we'll put the link in the chat. That document is also on the CRIS website. So if you want to take a deeper dive into it, community members, that's available on the CRIS website. I also want to note to Nicola's last point about number 5, that's also a key message in the steering committee letter that the work, there's still much work to be done. And that's an important note in the steering committee letter. So CRIS steering committee members, I know you've had a lot, you know, a few rounds of review on this, and we've had some discussion. Are there any continuing or lingering questions or concerns for you about or final feedback on the report that will be submitted January 1st, 2025?
I'm going to jump in. I want to just really, again, acknowledge the work that's been done. I know we've had several reviews, and it just really, I just want to say how proud I am. I know so many people have worked on it. You've really brought the information together. I'm just, having heard from tribal leaders, they just really felt heard and part of the process. And I think you did just an excellent job on that. So I just want to say thank you.
That's lovely feedback. Senator Orwell, thank you so much. Bipasha.
I just wanted to reflect, Nicola, the part you said where the report, it's good to report the good parts of what has happened in 3 years, but also to highlight that there is much work to be done. And I say that on behalf of the people, you know, in the lived experience space, because that is what they, you know, they are the people receiving what is happening at the end, you know, downstream of the process. So thank you for making sure that you captured that. Thanks.
Thanks, Bipasha. Other questions or comments from our steering committee members regarding the final report?
I'd
just like to add that I thought the report was excellent, and I was particularly impressed with the way we have incorporated the voices of lived experience. I don't know that I've ever seen a report that did it as nicely as this one did. So thanks again for all the work that went into organizing it.
If I might piggyback on that, by the way, for what it's worth, my name is Bipasha, she, they pronouns, and I represent the voices of folks with lived experience on the steering committee. And as Mark said, this is the 4th report that is being sent to the governor's office and the legislators, but the first one where direct voices from lived experience through their quotes is being included from Stories Project and the people who testified directly to the CRIS at the CRIS meetings. And I wish we'd done this before, but it's always better late than never. And Kristen and I worked very hard, and we thank HMA for their support through this process. But most important, I want to thank the folks with lived experience who've been showing up again and again since 2022, and that's 3 full years, to listen to what the state is going to do and has been up to in the space of behavioral health crisis response, and to make their voice heard in terms of services that A, don't exist, and B, that supposedly exist, but they are not benefiting from it. And I really appreciate that we have taken the time to include their voices, because as with any product, and a behavioral health crisis response is a product, it needs to be rated by the consumers who are receiving and using the product. So I'm really proud of them showing up And I wanted to thank you all for the support you all have given the people with lived experience. And when I mention people with lived experience, I also want to give a shout out to many, many people who actually work at DOH and HCA, who are both people who work in the sphere and also bring their lived experience. And I have come to believe that combining science with good governance and good, solid lived experience is one of the most powerful spaces from which one can work. In this case, it's behavioral health, but be it homelessness or access to food or education. And I really want to tip my hat, especially to those people who work at the agencies and have been showing up for over 3 years to listen to the voices and really echo them at the agencies when they have their own internal meetings. So thank you for that. Okay, I'm done now.
Well, I would just like to jump on to what Bipasha said and say, it can't be said enough, the amount of work and effort that Bipasha and Kristen Wells put into bringing these voices of lived experience to the CRIS meetings and incorporating them into the report. And that was all volunteer work. So I just want to express a huge amount of gratitude. And I think this should be, to your point, Bipasha, a model for how we do future similar reports, that those voices can be explicitly shared in, so that we can do a better job of drawing a link between what people are saying and what we're aspiring to do. So a big thank you. And I see a lot of nodding heads from our steering committee members. I think Senator Orwell probably wants to say something about that too. So Senator Orwell.
Yeah, and Bipasha and all the people that participated, I just want to call out also your leadership, because this has been a complex process and you have done so much to make sure that the stories were in the report and to guide the process. And you really are kind of the grounding and heart and soul of the report. And so I want to acknowledge that. And I also wanted to say why we have to continue this piece. We do have a lot of work ahead, and continuing the partnership with people with lived experience so that we're moving in the right direction. And so again, I just want to say thank you, and to everyone who participated in the group. Thank you.
And I just want to say, Rep. Orwell, thank you. You've come to so many of our meetings, and I really appreciate the way you show up as a person who listens and tries her best to respond from the knowledge base you have, to people's questions. I do want to say something. Yes, this was all voluntary for Kristen and me. We are deeply passionate about bringing the voices of lived experience. That's what drove us, but I want to highlight it is also privilege that allows us to do that. I have the privilege of not having to have a full-time job, so I can dedicate my time and energy to this. And so I just want to put here on the record that if the state does not find ways to compensate people for showing up, you are not going to get the voices of the most marginalized folks, because they are the ones that cannot show up and do this work and not be paid. They have lives to live and children to support and families that they love. So in whatever sphere, of course, in behavioral health and crisis, please keep that in mind. I want to thank you, Rep. Orwell, and Senator Dhingra is not here, for listening in 2020 and 2021 to the voices of lived experience and putting them on House Bill 1477. I really appreciate that. And I think of you all as two parents who birthed something that was tangible and visible. But as you know, mothering doesn't end with just birthing. So I'm really requesting that you keep your eye on that ball and keep nurturing and allowing that space to grow, where no matter what legislative action you're looking at, think of people with lived experience being able to show up, get their voices heard, and figure out ways to reasonably compensate them for it. Because my privileges allows me to do this, and so many people don't have it. Thank you.
Thank you, Bipasha. I also want to acknowledge Dr. Snowden's comment from earlier too. So thank you for that, Dr. Snowden. Steering committee members, excuse me, any other comments or feedback on the report before we vote?
Okay, I'll just say also, Dr. Snowden, thank you for your guidance for the story project. It went the direction it went because we had all kinds of ideas, but your expertise in providing actual care for patients and science really helped us, do it the best way possible that we could. So thank you very, very much.
Okay, so I just want to confirm Senator Dingra is on leave right now. So she asked Senator Orwell to vote by proxy on her behalf. So, and Senator Orwell just confirmed that she's ready to do that. And so I see on the screen we have our steering committee members, our voting steering committee members, Michelle Roberts with Department of Health, Bipasha Mukherjee, the lived experience representative. Jennifer Chancellor will be representing the governor's office today, voting Senator Orwell and Tisha Kirschbaum with Healthcare Authority. And then Dr. Stone is a non-voting member of the steering committee. I'm going to ask our steering, Amber, will Amber be voting for governor? Okay, sorry, apologies for that. So Amber leaders will actually be voting on behalf of the governor's office. So I'm going to ask, and you can use your raise your hand function or just raise your hand physically if you can vote on behalf of approving the final 2025 report to the legislature and governor. So all those in favor, please raise your hand either electronically or actually. Okay, so I see Amber, Michelle, Tisha, Bipasha, and Senator Orwell is voting for both. Yes, but Senator Orwell is voting both for herself and for Senator Dingra. So it looks like we are unanimously agreeing to approve the final 2025 report. I also just want to acknowledge, you might have noticed we're using a different title for Senator Orwell. She got a big promotion. So congratulations, Senator Orwell. And thank you for continuing to fight the good fight. All right. That's good. We took care of that in plenty of time before some of our steering committee members have to drop off. Any other final feedback or questions about the report before we move into action items and next steps? So Tisha, I hate to put you on the spot, but would you mind just, not everyone on the call today was in attendance at the last CRIS Committee meeting. Would you mind just sharing a little bit for action items and next steps about what's next for the CRIS Committee?
Yeah, happy to.
Okay.
Can you guys hear me okay?
Yes, you sound great.
Wonderful, thank you. Well, good morning, everyone. Tisha Kirschbaum from the Healthcare Authority. As I shared at the last CRIS meeting, our plan is to, when HCA takes over the facilitation of the CRIS starting in January, then our plan is to have our first meeting after the legislative session. Our plan is to meet quarterly. They're really going to be focusing on status updates. I think it'll probably, we're still working out this detail, but my guess is it's going to be a hybrid meeting with also an in-person option, probably in Olympia. At the Healthcare Authority has a room that we can all meet in for people who want to come in person. I think some additional so besides our kind of plan for continuing on with the CRIS meetings, I think some additional exciting information, I'm not sure if this has been shared broadly or not, is, Michelle and I have continued to meet with the lived experience subcommittee to hear their feedback, extremely valuable feedback about the importance of having a space for individuals with lived and living experience to come and meet on a regular basis and continuing that group on. We have figured out how to be able to continue with those monthly meetings going on in the future. We're working out all the logistics, but we are excited to report that, for the continuation of the CRIS, there's going to be ongoing monthly meetings of people with lived experience to continue to give their perspective and feedback on how things are going with the behavioral health crisis continuum. And if others have heard me provide this update in the past and there's anything that I have forgotten to share, please let me know.
Thank you, Tisha. Thank you for jumping in on that. Nicola, do we have any other action items or next steps we should? Before we go to that, I'm going to take Bipasha's question or comment. Bipasha?
Okay, I know I'm speaking a lot, but I do want to thank Tisha and Michelle for coming to our meetings and listening and understanding that the voices of people with lived experience actually helps their departments do their work in a much more holistic way. But I appreciate Tisha and Michelle, your support for continuing this process, because if we drop the ball, you know, people have been showing up, that would have made a difference. So thank you very, very much to you both and all your staff. Thank you.
Thanks, Pasha. Nicola, do we have any other action items we should flag for the steering committee and the community?
I think we are good. I think as Tisha mentioned, there'll be more communication coming around the meetings for next year. And for the report, we'll just work to finalize that and prepare it for submission. So I think those are our main things.
Okay, well, this has been a very efficient meeting today. It makes sense. We have done a lot of work to get to this point, so hopefully that's why things are wrapping up so neatly today. Before we end, I do want to give an opportunity for community members to make a public comment to the steering committee. So, Christine, have we received any requests?
No requests at this time for public comment.
Okay, I'll give folks one last moment here. So if anyone would like to make a public comment, I'll give you 2 minutes. Just use the raise your hand function to let me know if you'd like to make a comment.
Jamie,
Okay.
I'm not sure. I see Senator Orwell keep raising her hand. Okay, there, she figured it out.
Oh, okay,
I think
sorry,
she's
Senator
trying to
Orwell,
figure
please
that.
go ahead. Thanks for the help, Pasha.
Thank you. And I'm on my phone because my computer's in transition. So my apologies. But I did want to take a moment to thank you and all the HMA staff for your work. And I think of all the groups you've been holding and all the information we gathered, like how we, brought all the 988, 911 folks together, the various panels trying to understand agriculture. And I just want to say thank you. I know it's been probably hours and hours of work, and it's just, it's really helped us to understand what is an incredible system, building a new system. And I appreciate how you worked with people with lived experience, which many of us have, as well as the tribes. The other thing I would say for all of us to be really proud of, and I wish Senator Dinker was here, is because we did pass a comprehensive bill that included a fee. We have the ability to keep moving on and building with 988, where I know a lot of states are struggling right now that use state funding. So I feel like we're fortunate. I feel like I know we have more work ahead, but I just feel confident that we're going to continue with those investments. But again, want to say thank you. I know it's been a tremendous amount of work, so thank you.
And that's a really nice reminder, Senator Orwell, about having a dedicated funding stream. So thanks for noting that. I see a hand from Dr. Snowden, and then I have a chat from Pasha. Dr. Snowden?
Thanks. I just wanted to add, I think that the challenge that will be left with the report is the spirit with which it gets reviewed. I think it's an excellent report, and I'm very proud of the work, but it could be read in 2 ways. One, you can read it as the glass is mostly full and the recommendations are general enough that you can sort of work your way into saying, oh yeah, we've been there, done that. Or you could read it, I think, with the spirit that I got out of the meetings that generated the report, which is that yes, some good work has been done, but there is actually lots of work still to do, and to not simply be satisfied that we could rationalize a way into saying we've done this. And so I'm hoping that the spirit with which the report will be received and acting upon stays true to the way I think the committee as a whole and the public really inform the report.
That is such an important point, Dr. Snowden. And I think so much is about what the group that's on this screen and the CRIS committee members and the community do next with these tools that the CRIS and steering committee have produced. So, but I appreciate that it seems that my takeaway from talking with so many of you is that you are in the mindset that we need to keep charging forward. So I too share Dr. Snowden's hope that this report is a tool that you're all able to use to continue to advance and move forward and improve on the system. I have a chat here from Pasha that she's asked me to read aloud, which I'm a little bit embarrassed to read, but it's very kind and I appreciate it. It says, my thanks to HMA for their work through the 3+ years. And I want to give a hat tip to you, Jamie, for being astonishingly good at what you do. You make a huge difference in how these meetings went. So thank you for that, Bipasha. It's very kind and it means a tremendous amount to me. All right, let's see. Do I see any hands up for public comments? Okay, I think that means that I'm going to give you a early holiday gift of 30 minutes back in your day. So before we say goodbye, I wish you all a very happy and healthy holiday season. Happy New Year. I am so looking forward to continuing to cheer all of you on and do whatever I can to support advancing this work and getting the crisis response system we all want, aspire to, and deserve. And it has been an absolute pleasure and privilege to work with every single person on the screen these past years. I wish you all the very best, and I look forward to our paths continuing to cross in the future. So thank you, everybody. Happy holidays, Happy New Year, and take care. Bye-bye, everyone.
Thanks, Jamie. Bye.